I'm here with Lora McDonald. She's the executive director of an organization called More Squared, Metro Organization for Racial and Economic Justice, and Danise Hartsfield, yay, Thompson, who's with Communities Creating Opportunity. Both of them are social justice, community organizing groups that have been so beneficial in the Kansas City area and making sure that we have a solid place in what goes on. Good, good day to you both. Laura, can you talk about health disparities and why this COVID-19 is such a challenge in the African American community?
Morning or good evening. Thanks for having me, Reverend. Yes, I think that we've all seen the statistics, right? And we can even think anecdotally about the people we know, like the people I know who have contracted COVID-19. Of the 9 people I know who've gotten it, 2 of them are Caucasian. And the one person who passed away who I knew who had it was African American. So let's be real. The people we know, if we just count anecdotally, we'll find what we know to be true nationally. So the national statistic that came out just in the past 24 hours is that of the 100,000 deaths from COVID-19, 23% are African American. And the national population, I believe, is 13% African American. So right there we have a chasm of a disparity. That 10% difference is huge, right? And it's true of other people of color, including in Kansas City, more Asian Americans have COVID-19 as well as Latino Americans.
And the reasons for this this disparity, I think we can go ahead and say it is race.
I'm going to say it's racism, Reverend. I'm just going to say what I believe it to be. It's racism. And it's many, many, many factors of racism. And I think we are doing ourselves a disservice in a lot of the national reporting we're seeing, where it ties it only to economic impact around racism, because we know that poverty and Blackness are not synonymous, right? And most of the people of color who I know who've contracted it are actually people of means better than my own, and I'm middle class. So I think that we need to be clear that it's racism making the impact, not race and poverty and how those intersect exclusively, right? So there are poverty-related impacts, but there are also impacts like people showing up who should be getting tested who don't.
Yeah. Danise, from Communities Creating Opportunities stance, can you talk about health disparities and what maybe we ought to be doing to organize for change?
I'm glad to be with you tonight as part of the town hall, because as the reopening of the city has begun, too many Kansas Cityans are behaving like COVID-19 is over. But of course, things are about to get worse. Lora just mentioned the grim milestone of 100,000 Americans, and more than 23% of those would be people of color. We can expect more infections, more deaths. This is particularly true in the Black community. And though the virus is impacting people of all racial backgrounds, the infection rate and death rate for Black Kansas Cityans is disproportionate to our low population. Kansas City is 30% Black, but we make up 50% of the COVID-19 cases. The 3rd District has been hit particularly hard. This is a direct result of our city's history of slavery and Jim Crow, not to mention modern discrimination. Black Kansas City has been disproportionately poor since slavery, held back by white racism from decade to decade. We're still trying in 2020 to get out of the pit hole of intergenerational poverty. And where there is disproportionate poverty, there are disproportionate health outcomes. Poverty means a lack of health care. It means worse pre-existing health conditions. It means jobs that cannot be done remotely. and thus the Black community bears the brunt of this disease. That's what's on my heart tonight. Let's not forget the connection this evening, this intersection of race, poverty, and health. What we do now should take the connection into account. If this society and this virus aren't colorblind, our response can't be either. One of the things that I would hope that during this time that we would really focus in on trying to do one of two things, that we need to search for or reach for a response to the root cause and to the effect. We need a response to Kansas City's poverty and lack of health care, which is the root cause, and we need a response to the effect, meaning the virus and its deadly spread. Testing, protectionary measures like masks and social distancing and treatments are vital for the communities right now, but they can't be the only response. The other response must be addressing the social inequities and inequalities that led to disproportionate Black suffering in the first place. I believe that our clergy has a responsibility, and they have the ability to help us effectively address these inequities and inequalities that are currently existing in our community.
Yes, both Danise and I have the privilege of working throughout the faith-based community to organize. And the reason we do that is historically, you know, that's where African-American people could organize in this nation, right? In the Deep South, during the times of slavery, it was the Black church was the place, right? The place where people couldn't be stripped of public roles and public titles. It was minister is leader, right? And akin to what a congressperson would be for my cousins, right, in the South. And so, of course, we need to hear directly from the pulpit in these moments in times such as this, and through slavery, and then in the era of Dr. King, we know this, and we know today it's greats like you, Reverend Williams, and people across the nation like Reverend Barber, right, who are lifting these issues up nationally, and we need to pay lots of attention to this and share the message. You know, this is a time for the church to look at itself too, and say, is it enough that we're just giving food out? Or should we, as Danise was saying, look at the actual root cause? Let's continue to give out the food, but let's also see why there's a need for food that's disproportionate. And let's get into that. And so I'm sure CCO and More Squared would welcome conversations with anyone from the faith community or outside of the faith community that wants to get involved in addressing these health disparities.
Fantastic. Thank you so much for being on and being strong partners with us as we try to defeat this invisible foe. God bless you.